New Jersey has one of the highest rates of Alzheimer's disease in the nation. Joining us now is Brooks Kenny, Vice President of Consumer Engagement and Partnerships at Us Against Alzheimer's, and a Jersey girl. Brooks, welcome to the show.
Thank you so much for having me, Lisa. It's great to be here.
Well, I'm so happy that you are here with us. We met a few weeks back at the AZI Grand Opening Ceremony in Nutley, and I loved you and your mission, so of course I had to have you on here.
Oh, well, thank you. Likewise, it was a really fun day in New Jersey, and it's great to be back.
Well, talk to us about that mission. What does Us Against Alzheimer's do?
Yeah, so we are a nonprofit advocacy organization. Really, we envision a world where everyone across the country has access to prevention, early detection, and treatment of Alzheimer's disease. Alzheimer's disease impacts Blacks and Latinos and women more than any other groups. And we have a lot of work to do in the area of prevention, earlier detection, and access to treatment for everybody. And so we advocate for that on Capitol Hill. We advocate in the community. We work with providers. We work with families and communities to reduce stigma so that people can get the support that they need much sooner. Not unlike cancer, most cancers have early detection as part of the experience. And we really want Alzheimer's to be something that people start talking more about and actually get support much earlier in their process and journey.
It's super important. What are the big issues that you see in Alzheimer's disease?
Well, the biggest issue really right now is around early detection. It might surprise your viewers to hear that 60% of cases of Alzheimer's disease go unrecognized. Unrecognized. And those that do get diagnosed often get diagnosed in the later stages when there's a crisis, when someone is wandering or gets lost or has an accident or a fall. We need to get people into the system sooner so that they don't have to suffer. There's so much suffering in silence in Alzheimer's disease, and we're trying to put an end to that. I would say detection is probably the biggest issue. The second issue I would flip on its head and call an opportunity, and that's around prevention. The science has really been catching up, and we now know that more than 40% of Alzheimer's cases can actually be attributed to lifestyle factors. So there's things each and every one of us can start doing today. We can try to eat nutritious meals, not a lot of not a lot of processed foods, limiting alcohol, moving our bodies, making sure we're connecting with friends and family and staying socially active, reducing things like hypertension, heart disease, and diabetes. All those things that we talk about that are good for the heart are good for the brain. And those things can start to make an impact, early on. So we're encouraging adults to really think about their brain as a vital organ, just like they do other parts of their body. So we think prevention and early detection are really the keys to unlocking a real shift in the movement, if you will.
I mentioned in the intro that New Jersey has some of the highest rates of cases in the nation. Why is that?
Well, I haven't done a deep dive into New Jersey, but I think some of it is related to age. Age is the number one risk factor for developing Alzheimer's disease. But make sure this is really clear. Alzheimer's is not a natural part of aging. If you forget somebody's name in one moment and you remember it later, that's just normal aging. As our bodies change, our brains change too. So we know that age is a risk factor, but it's not inevitable. So I want to make that distinction. There are about 200,000 folks in New Jersey that are living with Alzheimer's disease, and those are just the ones we know about. And then there's about 360,000 family caregivers. So not professional paid caregivers, but people in someone's life who are helping to take care of that loved one with a diagnosis. So it's a pretty significant number of folks in New Jersey that are dealing with Alzheimer's today. And those are just the ones we know about.
Well, you make a good point, the ones we know about. There's such a stigma around this disease. People don't want to talk about it. And the same goes with mental health issues. Why is there such a stigma around anything related to mental health?
Well, I'm so glad you asked that. And I really applaud your network for continuing to talk about this because that's what needs to happen. Right now, we know that Alzheimer's disease is the number one fear of people 50 and older, yet it is the least talked about topic in our healthcare conversations. We know that providers, oftentimes primary care providers, don't want to raise the topic themselves because there are not a lot of options for treatment today. And so it's hard as a provider to talk about something where they can't help solve the challenge. Although we're hopeful that new treatments on the horizon, coupled with the prevention tips, give more opportunity for providers to have these conversations. But think about it, none of us want to lose our memories. You know, our brains are central to everything we do, our thinking, our memory, our emotions, and none of us want to lose those things. We don't want to forget our memories, and so I think there's a lot of fear that comes with that, and so bringing it up is a challenge, and that's another reason why we focus so much on brain health and words like prevention, because we think if we can come at it from that perspective, it allows us to normalize those conversations much earlier in someone's life, so by the time they might be developing any types of symptoms for Alzheimer's, they've already been kind of engaged in those brain healthy conversations. I just think it's really scary. And I also think for so long, we have seen people in in the news or in entertainment or what have you, where that person was depicted as a very old frail person sitting in a dark room, with the curtains drawn, and that's not the typical person that's diagnosed with Alzheimer's disease if they're diagnosed early. I mean, we know many people that are living with the disease, they're living independently, they're still working, and we just don't see that enough. And so it's exciting to kind of think about how we can shift this narrative and get people engaged in these conversations and normalizing them more. And that's a big part of the work that we do.
Well, thank you for coming on here and normalizing the conversation for our viewers. Where can people learn more about you and Us Against Alzheimer's?
Absolutely. Well, folks can visit usagainstalzheimers.org, and they can also visit mybrainguide.org, which has brain health education information, memory questionnaires that people can take on their own. And you can learn more about signs and symptoms of the disease so that you can be informed and learn what steps might be best for you in your journey. So I hope folks check it out.
Thank you so much, Brooks.
Thank you for having me.